Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's daily bulletin. Supreme Court on Monday deprecated the aggressive and invasive practice of the two-finger test on rape survivors and said it has no scientific basis and instead re-victimizes women who may have been sexually assaulted and is an affront to their dignity. The two-finger test is conducted on victims of sexual assault and rape to determine whether they are habituated to sexual intercourse. The top court said it is patriarchal and sexist to suggest that a woman cannot be believed when she states that she was raped merely for the reason that she is sexually active. It said any person who conducts the two-finger test or per vaginum examination in contravention of the directions of this court shall be guilty of misconduct. A bench of Justices D.Y. Chandrachud and Hima Kohli made the remarks in a judgment on a plea of the Jharkhand government in which it challenged the acquittal of one Shailendra Kumar Rai alias Pandav Rai of rape and murder charges. The top court overturned the decision of the High Court and upheld the trial court order holding Rai guilty of rape and murder and awarded him life sentence. According to a recent notice, the MCC has informed that the mop-up round of NEET PG counselling has been put on hold as many PG diplomat of National Board institutions have taken offline admission of candidates. In its note, the MCC stated that this is in reference to registration for mop-up round of PG Counselling 2022, which was scheduled to start from 31st of October. However, many PG DNB institutes have taken offline admissions of candidates for round 2 of PG Counselling 2022. Metformin usage has beneficial effect on polycystic ovary syndrome women by decreasing body weight, total testosterone, BMI, fasting blood glucose and raising the chance of pregnancy, according to an article published in Therapeutic Advances in Endocrinology and Metabolism by Sage Journals. With a frequency of up to 20%, polycystic ovary syndrome is a diverse endocrine disorder that affects women of reproductive age. Menstrual abnormalities, polycystic ovarian morphology, and excess androgen are biochemical and clinical hallmarks of PCOS. The primary glucose and lipid homeostasis cell regulator AMP-activated protein kinase, which is stimulated by metformin, decreases hepatic glucose synthesis. Inhibition of glucose in the hepatocytes is linked to AMPK activation. Research was done to conduct a assessment of the literature on the therapeutic effects of metformin on the clinical and metabolic parameters in PCOS affected women. Holding the Christian Medical College and Hospital in Vellore of guilty of medical negligence while conducting caesarean operation on a woman, the District Consumer Disputes Redressal Commission has recently ordered the hospital to pay ₹15 lakh compensation. While conducting the C-section operation back in 2015, the doctors allegedly left a cotton pad inside the body of the woman. Further, the Consumer Court noted that the store records of CMC had been tampered, therefore the hospital has been directed to pay the compensation within 45 days. If the hospital fails to do so, an interest of 9% shall be levied on the compensation amount.
Neighborhood walkability, a measure of how easy and safe it is to walk to reach resources for daily living such as a grocery store, pharmacy, school, work and church, is associated with lower cardiovascular disease burden and risk, according to 2 preliminary studies to be presented at the American Heart Association's Scientific Sessions 2022. Cardiovascular disease is the #1 cause of death in the US and globally, according to the American Heart Association's Heart Disease and Stroke Statistics 2022 update. A key component for achieving optimal cardiovascular health and reducing cardiovascular risk is physical ability. Adults who regularly use electronic nicotine delivery services or e-cigarettes displayed worrisome changes in heart and blood vessel function and performed significantly worse on exercise stress testing than people who did not use any nicotine products, according to 2 separate analyses of preliminary research. The CLUE study was conducted by researchers at the University of Wisconsin between March 2019 to March 2022. It was designed to examine the short-term effects of vaping and cigarette smoking in regular nicotine users compared with similar matched peers who didn't use nicotine in any form. The study included 395 participants. Social vulnerabilities such as living in poverty, living in a single-parent household, not having a car, or being described as a minority were linked to increased cardiometabolic risk during pregnancy, according to preliminary research to be presented at the AHA Scientific Sessions 2022. The number of pregnancy-related deaths in the US has increased in recent years, and about one-third of these deaths are due to cardiovascular diseases, according to the CDC Prevention. In this study, researchers explored the link between cardiometabolic factors and social vulnerabilities. One dose of an antibody-drug safely protected healthy non-pregnant adults from malaria infection during an intense 6-month malaria session in Mali, Africa, a National Institutes of Health clinical trial has found. The antibody was up to 88.2% effective at preventing infection over a 24-week period, demonstrating for the first time that a monoclonal antibody can prevent malaria infection in an endemic region. An estimated 241 million cases of malaria occurred worldwide in 2020, according to the WHO, resulting in an estimated 627,000 deaths, mostly in children in sub-Saharan Africa. The study team for the Phase 2 trial enrolled 369 healthy non-pregnant adults aged 18 to 55 years in the rural communities of Kalifabougou and Torodo in Mali, where intense P. falciparum transmission typically occurs from July through December each year. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.